The only incentive for antibiotic overuse is for the drug suppliers to get a lot of money. That is all. Because you continuously buy the antibiotics. The one who is supplying the medicines will be very happy. So the big pharma and the rest say, our products are being procured. But at the cost of what? The cost to the patient, the cost to the facility, the cost to the system that we are running. There's a lot of reasons why we should not overuse antibiotics. One is the cost. The second one is the abuse of antibiotics, and which will lead to antibiotics resistance. If you are using antibiotic or overusing antibiotic, what it means is that you are prescribing irrationally. Then you don't target what the problem that the patient has. And if you don't give the right antibiotics at the right time, at the right place to a patient, the patient will develop resistance. And it means as a hospital, you continuously be giving more antibiotics to people because you don't know what you are treating. So it can be this, it can be this, it can be this. So by the time you realize, maybe the sort of bacteria or the viral or the parasite that you are dealing with, that's not what it needs. Maybe it's promoting some kind of resistance so that when you want to use that antibiotic for a particular patient who has an infection at that time and he needs that type of antibiotics, the antibiotics will not work because the body has developed resistance to it. So there's a lot to gain for not overusing antibiotics. The rational prescription should be the one who should be encouraged. It makes you a very good doctor or a very good clinician. It makes your patient not stay in hospitals for a long time. It makes your patient get well quicker and go home quicker. And then the outcomes of all your procedures and your interventions will become successful instead of keeping the patient for years and ages. So everybody will see you as a doctor who gives quality care or a physician who gives quality care to his patients. And the hospital will be seen as a hospital where when you go, you don't spend so much money and you get better. So that is the essence of prescribing rationally and making sure that you give the right antimicrobial substance to patients at the right time. But you can do all these things to also make sure that people prescribe antibiotics or antimicrobial because maybe of hospital-acquired infections. So both the patient, the caregivers, and also the physicians and the rest in the hospital should make sure that they follow strict infection prevention and control so that you don't give the infection to the patient so that you can have the chance to give more antibiotics or antimicrobial substances.